Many of us were anxious to see how the House on State House Road would respond or hold their Friday meeting to what is described as a surge in COVID-19 infections. We'll now have to wait a bit longer as the extraordinary summit scheduled between the national and county governments has been pushed to Monday. Whatever action they choose to take will be informed by expert advice. Ahead of the curve, we engaged an expert on what to expect.
A surge, defined as a sudden, powerful forward or upward movement, a tide, or more simply, a sudden large increase, albeit a temporary one. This is what the national government tells us we're experiencing following the opening up of inter-county movement. But according to the experts, what we're experiencing are ripples, and the tidal wave is yet to come.
We can't talk of a surge now, but we are talking about the number of infections actually increasing exponentially, which is expected, in a situation where you actually don't have, everyone wearing masks, everyone practicing social distancing, everyone washing their hands. So the numbers are still rising.
When he announced the easing of restrictions of movement on July the 6th, President Kenyatta promised the measures would be reviewed depending on how the situation evolves.
The order to reopen is given conditionally. Should the situation deteriorate and pose a challenge to our health infrastructure, we will have to revert back to lockdown.
The rise in infections following the opening up of Nairobi, Mombasa and Mandera appear to have given the national government reason for pause, and they correctly surmise that the number of infections is far higher than the 15,000 on record.
What we have been getting from the media is are numbers based on those who are tested. Remember that that is not accurate reflection of those who are infected per se. If you ask me, in terms of the numbers that we are seeing in Kenya now, I would suggest that those numbers are less than 10% of those who are actually infected.
And while the government was optimistic that the new year would herald a new dawn, the worst of COVID-19 behind us, expert projections are more realistically grim.
In Kenya, we have not actually reached the peak. So we have not reached the peak of COVID-19 infection in Kenya, but epidemiologists, these are people who are monitoring transmission of this virus in Kenya, they are saying that we are likely to peak towards the last quarter of this year. So from September going to December, we are likely to see the highest number of people who are, infected, and then we will stay there at a flat rate for months, say from January to March, and then we start plateauing down to fewer numbers.
Given this bleak outlook, what then would be the best course of action?
The people will require ICU. How many counties in this country have enough beds to take care of this? You can imagine if you live in informal settlement like Kibera, you are living in one room with 7, your children and husband. How do you protect them from getting infected? So my next advice for the president is that we may need actually to think of using, centers like stadiums, like the stadiums that we have across the country, to isolate.
COVID-19, clearly a catch-22. Olive Barrows, NTV.